Hello and welcome. Thanks so much for joining. I'm excited to be at Call of the Wild once again and to talk to you today about the importance and the benefits of the One Health approach in our field. My name's Dr. Isabelle. I'm the director for the Belize Wildlife Referral Clinic, or BWRC. One Health is truly a topic dear to my heart, and you will see me use a lot of images that are not mine, that are from the CDC and others, a little bit to showcase too that we didn't make this up. It is gaining more and more importance. I would like to know who all in this audience is already familiar with the concept, and maybe you can put that in the chat while listening. So what we're going to do is to connect our environment, animal, and human health. For the content, I will give you a brief introduction of ourselves and what we do, and then about this One Health concept, the issues, and what we mean with that. I will take a little extra focus on zoonosis, which is one of the main or most important issues potentially under this concept, and then talk to you how we can use this knowledge to our advantage in our field. And if I have to emphasize the importance of cooperation in conservation, but even more so in One Health is absolutely essential. So I'm going to turn off the video so that it's not in the picture the whole time, if I can accomplish that. So we're going to start with a brief introduction. The BWRC was founded in late 2011. Our vision, wildlife conservation and sustainable development through cooperation. And the lengthy mission, supporting wildlife conservation, animal welfare, and the veterinary profession with veterinary care education, research, and again, collaboration, seeing that both our vision and mission have cooperation in them, again, to emphasize how important that is, since we cannot do what we do on our own. So what do we do on a daily basis? We care for injured, orphaned, neglected, or somehow imperiled wildlife, and we hope to be a voice for humane treatment of animals. We work as a non-profit, non-governmental organization under an agreement with the government, and we assist the governmental forest department in their mandate as it relates to wildlife. We're a teaching clinic and rehabilitation center, providing vet care, surgery, rehab, rescue and relocation assistance, and most importantly, environmental education. Our team have by now treated over 5,000 wildlife patients, and we train about 120 persons per year, and we do track our charitable services, as I was taught a long time ago by Wildlife Center of Virginia's co-founder. And we also provide field support, my favorite. We work with the scarlet macaws, the Central American river turtles, as well as green iguanas and crocodiles a lot in the field, to the point where 2/3 of my patients are seen in the field. Some captive breeding support for conservation reintroductions, that is, and then again, a lot of training, workshops, outreach, as well as some referral services for domestic animals, and some forensics as well is quite common. So we do a lot of necropsies, not only of our patients, but also animals that are sent to us to determine what happened or was foul play involved. Like this ocelot, for example, that has a lot of lead shot in him and marble eyes on this X-ray, and some broken bones. To the origin of our patients, I always have to emphasize that also drives why we do the outreach. 30% of our intakes are victims of illegal traffic. Oh, around 50% are victims of human-wildlife conflict. So in total, 70 to 80% are anthropogenic causes, so because of humans. And many, many, many times, most times, the humans didn't know any better. And sometimes they even had really great intentions and made things horribly wrong without knowing. So education is key. We developed an educational program, WAP, Wildlife Ambassador Program, that's a 15-hour accredited program, and we talk about the main causes, human-wildlife conflict and traffic, as well as this One Health approach and concept, and hoping to improve the response to these emergencies. But now to the One Health concept. What is that? It started as an idea that our health is connected to the health of animals and our shared environment. And you will see these three circles quite often in different versions that represent this idea and concept. For us, it became a really important concept and approach because we use this as an argument when we protect one. In our case, we protect wildlife health. We help protect all because ultimately, of course, we have to talk to humans and we want to appeal to humans. And they may not care about the wildlife in itself, but when we link it to their health, it becomes a whole new importance. So as a brief summary, the issues that fall under this concept that are impacted by both human, animal, and environmental health, all three, would be number one, zoonotic diseases. And I already mentioned, I will talk a little longer and give some examples there. Antibiotic resistance is another hugely important One Health issue. It impacts food safety and security. If our animals are not healthy, then they're also not healthy eating, or if they are processed in unhealthy environments, it's again impacting humans. I will give some brief examples of vector-borne diseases and further examples of how this all links up. This slide here shows a little more what plays in. So we have another depiction here of our three circles in the middle where they connect and overlap, and then the factors that impact each. And as it says here too, this is not exhaustive. These are just some examples, as there's truly too many elements that impact. So environmental health here impacted by climate change, water pollution, air pollution, deforestation, and biodiversity loss. When we look at our animal health and human health, we have these really close connections here with food security and as well the antibiotic use and impacts that that has on both human and animal health. Here is a billboard that we made under a program funded by the Global Environment Facility and United Nations Developmental Program. And we made our own logo. And you can see the same scheme here, environment, humans, and animals. And we did have that discussions. Do the humans always have to be on top? But ultimately, we decided to leave them there because we are trying to make this concept more known to normal people, to showcase a little bit how this affects everybody. What it says on there is One Health, translated into Spanish, Maya, Mopan, Yucatec, and Garifuna, all the same One Health. And Kanak Alawi is Creole, that is not the official, but the most spoken language in Belize. And it stands for Connects All of Us. And then here we have our phone number as the main message. If you have trouble with wildlife or wildlife in trouble, then call us. We will help. Yeah, little backtrack. My first experience in One Health as a veterinarian was actually my PhD, which was in parasitology and epidemiology, or more very specifically, poop samples collected from public parks and beaches. And this was done to determine the human infection risk with zoonotic parasites of dogs and cats. This was a very rare, exceptional PhD that was actually funded. I did not have to work at the same time, which in veterinary medicine in Germany, that was quite common. But no, this actually got funding because I was looking at something as a veterinarian that impacts humans. And what I was doing was looking at samples from the environment, because that's where we humans often get infected with this. So it comes from the animals, it's stored in the environment, and it ultimately impacts us. So that was the backtrack. Now we can give you a full-on definition actually here. Joint tripartite. So that's the Food and Agricultural Organization, the World Health Organization, and the World Animal Health Organization, that together with the United Nations Environmental Program coined a definition for what is this One Health approach. And you can read it: an integrated, unifying approach aiming to sustainably balance and optimize the health of people, animals, and ecosystems. So that must have taken many, many sessions to coin every word. But there you go, you have it. Why was that coined in 2021? Anybody can take a guess? I assume so. So COVID finally drove home this idea, concept, and the issues as a global pandemic, zoonotic disease that jumped species. And yeah, here even the World Bank Group speaks about One Health, which tells you how important this concept actually is. And upsala. No, wrong button. This is citing an old publication from 2008 that I used a long prior to COVID to try to explain how important this issue is. The article was in Nature, and it talks about the global trends in EIDs, so emerging infectious diseases. And here is a very short list of these emerging, so newly arising infectious diseases. And I assume that some of which you're familiar with, definitely avian influenza, West Nile, while Ebola was actually re-emerging because it was an old virus that came back. The majority of these diseases, so this article looked at 40 years of emerging infectious diseases and found the majority was actually zoonotic. And of those, 70% came from wildlife. But yeah, no one wanted to hear about this. And then came COVID-19. So finally, even the big global organizations came to realize these connections and how important it is to take this into account. There is the article. So a few more. This is from United Nations Environment Program. Yeah, what are zoonoses? I didn't introduce it. I assume most of you are already very familiar. Here it says they're transmitted from animals to humans. It's the anthropocentric view again, and I like to harp on that a little bit. It goes both ways in many of them. But how prevalent are they? 60% of all infectious diseases in humans are shared between species. And of these EIDs, and why are we so scared about emerging infectious diseases? Because they can turn into a pandemic. So that's why they're always extra scary. Well, 75% of those actually came from animals. And there again, the majority came from wildlife. So it gives huge importance to wildlife health. That's why we have used this approach and concept for many years already. So I like this here better from the CDC, spread between animals and peoples. It goes both ways. Of course, humans will always be more concerned about themselves, but as wildlife rehabilitators or rescuers, we always have to be concerned to not spread diseases to our charges either. So common flus and the likes, we wear masks. and protect the animals from us just as much as we protect ourselves from their diseases. Again, emphasis, more than half of the human infections are zoonotic, and yeah, between species goes both ways. A little bit of a pet peeve for me. Most emerging infectious diseases are zoonotic and originate or are shared with wildlife. So knowing about this and how to prevent them, most importantly, is, yeah, priceless for many, many reasons. So do you know any zoonotic diseases? Again, in this audience, I am guessing yes. I usually hint it's like, think of really bad ones, and most likely that's a zoonosis. There is an endless list. As you just learned, 75% of those are shared. So it's the vast majority, and I can't list all the diseases here, but we have rabies, West Nile, tuberculosis, anthrax, plague, salmonella, influenza, brucellosis, which I'm not sure if you have heard of this, and the list goes on and on. Common ones here: hookworm on an obviously human foot, ringworm, toxoplasmosis, scabies, really unfortunate. Well, here, there's rabies, and there's some tapeworms in there. The list goes on and on. There are some crucially important ones. Example, rabies here, that is a huge concern for us, for you as well. You may know there are different forms of rabies. The animals can either be furious or unusually tame, or the dumb form of rabies. We have to prevent bites at all costs. And any abnormal acting or paralyzed animal, warm-blooded, is suspicious. Anthrax, very rare, but very resistant in the environment. Why they taught us in vet school to never open any animals in the field if they have a bleeding disorder or an unknown cause of death, an acute death, to not contaminate the environment, because these spores can last in the environment for up to 50 years. And yeah, every single disease I could talk an hour about, which we don't have the time for right now. Anthrax was also used as a bioterrorism weapon, and yeah, there is a lot to it. Fortunately, very rare. Now to some common ones that you may have even seen on yourself. The so-called ringworm, a fungal infection that can be transmitted very commonly from cats or pets, as well as multiple wildlife species. Slowly developing with medical attention and recognition early on, it's really no big deal. If it goes and starts to generalize, at this point, it starts to get a lot more severe and requires longer, harsher treatments. Excuse me. The next common zoonosis, not just here, but also worldwide, Giardia. We have different genotypes that are shared between different hosts, but both monkeys are very common here for us. When we have close contact between humans and the environment where the monkeys live, they may contaminate the water source and cause Giardia infections in the humans there, as well as dogs and other species that we share this with. And we'll talk about prevention here in just a second, a little more. One extremely common zoonosis, professional, very high risk for all of us, wound infections, of course. Just in case you didn't know, how do you recognize your infections? You have four main signs. It's swollen, it's red, it's hot, and it hurts. How do you prevent it? Well, you use proper protection and prevent injuries. If you do get injuries, you apply proper wound care right away, and then this will not happen. This is what I did my PhD on, is these so-called zoonotic parasites from dogs and cats. which is the best argument to convince people to deworm their dogs and cats, is because if they don't, the animals will contaminate their environment and put at risk children and others who are in close contact with soil and sand that could be contaminated. So we want everybody to deworm their animals because of the welfare of that animal and their own health, but also to protect human health. Yeah, larva migrans is the name of the condition in humans, and there's different versions and forms of it, some more severe than others. None fun. Just to complete that list, so TB, we are particularly concerned in monkeys. We do have it in humans here. We have not yet found it in monkeys, but it is certainly high concern. Psittacosis in birds is another long story. I have to point out that we do have additional short videos of 8 to 15 minutes or 12 on most of these diseases on our YouTube channel. Because, yeah, each of these diseases is globally important and would take a long time to really cover. And parasitic worms, I just mentioned a couple of them. There are many, many more. Oops, that is double. So how do we get these zoonotic infections? We have different ways we can get it directly or indirectly via the environment or via vectors as well, live vectors as well as inorganic material, soils and plants. Many, many infections. So it depends on what is it. But many, many of them we will get via oral acquisition. And like licking dirty fingers, eating without washing their hands, or walking barefoot in areas where it's not appropriate by allowing inappropriate contact. So we want to know how to stay safe. Number one, use your personal protective equipment appropriate for species and activity. Always wash your hands before eating and disinfect and wash your scratches and bites. Control the parasites in your pets and charges. Keep your pets vaccinated, aka rabies. The best protection is to vaccinate the animals. And yes, last one is a little bit of a stab. Ask your veterinarian, because veterinarians have to study zoonosis in school, and the importance is certainly impressed on us in school. Yeah, once repeat personal protective equipment. We could spend a whole hour talking about different types of equipment, thicknesses, lengths, and gear. You need species-specific training. You need to know how to deal with what species and what are the risks involved with every species, from their defense weapons to their potential zoonotic diseases. And then according to that, you use your protection. Yeah, you have to harp. We do everything we can to prevent any injury and bites. However, they do happen. In my experience, you cannot avoid them 100%. When they do happen, don't be like many and keep on going, but excuse yourself and take proper care of your wound and wash it. So World Health Organization recommends a minimum of 15 minutes. I harp and harp on people to do at least 2 minutes of really good washing with soap and water, and then cleaning it with iodine and applying ointment afterwards. And depending on how severe the wound is, you need to go to the hospital immediately. But smaller wounds that are quite common, if you care for them properly, they won't go bad. If you don't, you're guaranteed almost to get a wound infection, and that can get life-threatening if you continue to neglect it. So, soapbox. So how is this useful to you? Well, you can protect yourself and others. That is, to me, already the biggest argument. We use this all day long to educate our illegal, often unknowingly illegal owners and good-meaning general public people who want to help and have gotten themselves in trouble by keeping an animal that they're not supposed to have. We don't want people to hurt the animals because they're so scared. So we emphasize usually that it takes inappropriate contact for you to contract these diseases, but it helps. I think I have an example story here in a moment still, how I finally learned this lesson. So yeah, let this assist you in convincing illegal owners to relinquish animals. We don't have any authority, legal authority as an organization or entity. So we can only use our mouths to convince people to do what they should be doing. And in some serious cases, of course, then we have to call and report to the police for assistance because we do not have that authority. So yeah, not many care about the legal argument that it's illegal what they're doing, or that the animal will die on them anyways because they need specific care and the people are not qualified for it. But everybody will listen to you when you talk about the risks they're taking for their health. And if you then talk about their loved ones, their children, you will generally almost be guaranteed to have their attention. Yeah, I recommend vaccination for rabies for anybody working with wildlife, first aid training, and making sure your tetanus is up to date because those were very common for the last one and very high risk for the first one. So with that, enough on the zoonosis importance and a short list. Another big One Health threat is AMR, antimicrobial resistance, meaning antibiotics do not work anymore. So the World Health Organization cites this as one of the biggest threats to global health, food security, and development. And we're talking human global health and food security here. And it affects anybody, any age, any country. Yes, the resistance in antibiotics occurs naturally. It's an arms race between antibiotics and germs, but it's mostly driven by misuse in animal medicine and human medicine that is speeding up this process. So there's a little slide on what could be common sense. How do you prevent antibiotic resistance? Is by only taking antibiotics when you really need them. Sometimes they're overprescribed. It's an easy out. The next issue is humans are prescribed the antibiotics. They feel better in a couple of days and then decide to stop taking them. That also can cause low levels of antibiotics to be present when not all bacteria are completely dead, which leads to the development of resistances. But a major impact is the use of antibiotics in livestock and as well as in fish farming. And last but not least on this list, so again, this is a hugely important topic and it's impacted by what is done in animal health as well as human health, and then compounded by the fact that no new antibiotics have been developed in decades, which means we will eventually run out of efficient antibiotics, and then people and animals could die of simple wound infections again, throwing us back 100 years. Yeah, briefly on food safety, I already mentioned this is impacted by the health of animals as well as our actions, as well as the environment. And quick jump to the next One Health issue being vector-borne diseases. This may be something that you are already quite familiar with. So a vector-borne disease is transmitted by a live vector, for example, insects like mosquitoes, sandflies, and ticks as the very, very common ones. but it can also be transmitted by inanimate vectors. And diseases such as encephalitis, yellow fever, Lyme disease, leishmaniasis, dengue or malaria, for some big name examples that cause issues worldwide. So these diseases depend on the vector for transmission. Many of them are also shared with domestic and sometimes domestic and wildlife species. So they have reservoirs in animal species. They're transmitted by a vector, sometimes with a component of the environment in there. And then the ultimate disease in humans can be rather very serious. So here our World Health Organization slide says spread by vectors kill 1 million people every year, and more than half of the world's population is at risk of vector-borne diseases. You may have heard they are on the rise. This is often because the climate impacts the life cycle of the vectors and makes it more suitable, where we used to not have the vector for heartworm, for example, in Northern Europe. And it's been moving north from the Mediterranean over the course of the last decades. I'd like to use vector-borne diseases as another explanation for what is that One Health approach. So we have this disease that is everywhere in the environment, in the animals, in the humans. For us to prevent it from reaching humans, we take out the vector in the environment very often, either killing the vectors or treating the environment to make it unsuitable for the vector. So drying up areas where the vectors live in water bogs, for example, which is better than waiting for humans to get sick, especially with viral diseases or diseases that otherwise we have very limited or no treatment for. So the One Health approach is, can we actually eliminate it in the reservoir? If that's complicated, for example, many wildlife species, you can't eliminate them as a reservoir because you can't just eliminate the species. But then you can fight the vehicle, the vector in between. I hope that makes sense. So what factors are increasing the emergence of these diseases? We can start with deforestation, habitat loss, land use changes. We have poorly regulated wildlife trade. We have climate change, and we have intensified agriculture and livestock production. And here, antimicrobial resistance as well, that make this process become more and more intense and faster, more and more zoonosis emerging. Yeah, here another, who's this World Wildlife Fund image here, starting with deforestation, wildlife trafficking and collecting. Then you have these animal markets where you have dense populations of different wildlife species, maybe some domestic species in there as well, and humans, which is a petri dish for these germs, enabling them to jump species until they succeed to infect a new species, increasing this risk of zoonosis. My apologies, that slide's quality is not very good. Here is just one example, because this presentation isn't about my other next common topic, which is traffic. This is just to give some numbers, just to give you a rough idea. This is from Hong Kong. 180 million to 1 billion frogs. There's many species in the trade that one commonly doesn't think about. So ivory is, of course, a classic topic and still being seized a lot. And tigers we hear about, and rhino horns. But there are also many reptiles. Yeah, 10 million reptile skins. take that in between 2005 and 2013. So this is just the number of confiscations in Hong Kong, which is a global hotspot. And this trade drives the emergence of diseases. Here, a short list starting from the bottom up here with SARS, severe acute respiratory syndrome, 2002, 2003. Then came the swine flu, then came the MERS, and came an Ebola re-outbreak, then came Zika, and then came COVID-19, and that one really stuck and caused millions of deaths. But it was by no means unpredictable. And it's quite predictable that this will happen again. So yeah, the bigger picture of this outreach and approach is to prevent the next pandemic using a One Health approach. And what can you do? Stop wildlife crime, another image from the internet, dead serious. That is certainly something that drives. That is where COVID emerged in illegal wet markets of multiple wildlife, domestic species, dense populations of humans. Classic description. So stopping that can certainly help. How about the zoonosis? Learn about it, be aware, support that approach, and what can really help to fight these more effectively is starting with surveillance as opposed to waiting for outbreaks. Track what's going on and start predicting future outbreaks and prevent as opposed to reactive. Maintaining good health, obviously, and education is just key to help people understand how they can protect themselves. An emphasis here for many people that we talk to is report diseased dead animals and let us have a look at them so that we can actually do more surveillance. So that is currently very much in the works to increase surveillance in wildlife for our country. Yeah, this is a very personal case, a car crash. How does this connect to One Health? This car accident, 5 severely injured persons, 1 fatality, which is a very close friend of mine. And why did it happen? Because somebody didn't care for their horse and let their horse roam for weeks along the streets. And this horse caused this accident that, caring for animals often can save human lives. Just as an example of how wide this all is and the ramifications and how what we do to animals will ultimately impact humans. Many of you are engaged in mitigating human-wildlife conflict, and that truly for us is the majority of intakes. So a big key to reduce these risks in that mitigation by, in our case, and I think many of you in the US do this as well, where you have a hotline so people can call you before they do anything bad. And there is a lot of references for this, or more references by now, on conflict management, prevention, and mitigation. So why do we use this concept and approach in wildlife education? Because that's something that we all share. We may like the animals, and my monkey experience was trying to convince somebody who I asked about a report that I had received of an illegal monkey baby that was being sold. And then this person told me, oh, no, that's gone already, but I want one. And I tried to convince her that that was, well, illegal, because I was shocked that she was just telling me that she was going to catch one in her backyard and take a monkey pet. She'd long thought about it. And I told her, well, that's illegal. And she didn't care. And then I tried the welfare approach and said, well, but they're very sensitive. They're going to die. And she cared a little bit, but not really. And then she asked me, I heard they have lice. And I finally got the memo. And I told her, well, yes, and they can have diseases that you and your kids can get. You won't get them if you just look at them. But if you take them as your pet, that's a very big risk. And within 30 seconds, I had the woman's 100% attention, eyes wide open. And she called out to her husband and let him know that they were not going to take a monkey pet because it could give them diseases. So that gave me that ping. Okay, we don't talk about law, we do, but that's second or third argument. We talk about animal welfare, yes, but we talk about human health and the impact on humans by their actions. And here is a koadi that we turned into a little poster. And yeah, you can see the same disease. You don't make good pets. It's fully illegal, but let's use the disease argument first. Yeah, the Wildlife Ambassador Program, I had presented on that last year. We developed this to drive home all of these points and do capacity building in Belize. We developed pocket guides and the certification program. We do have a YouTube channel. I recommend if you're interested in learning on some zoonosis and more about this, check it out. We had and will have again live events and etc., regular posts. We did outreach via Facebook and Instagram, live events, newsletters, a total reach of 367,000. And we have about 20 hours uploaded to YouTube. And here are some poster examples and some of the results where we had in the end slightly over 400 persons who we had trained, with the vast majority being police officers and enforcement entities. We had a national conference with all of these persons, and checking my time real quick to make sure. And this was all presented last year as well at Call of the Wild. We tracked the hotline calls we got from it and how many we were able to solve over the phone already. We tracked 217 traffic interventions thanks to this program. And we also acquired a wildlife ambulance thanks to this EU grant. And in the other results, most exciting were the police officers who went from deadly afraid snake killers to providing assistance to concerned citizens and helping with relocations, non-lethal, of boas. And yeah, these illegal traffic interventions, including confiscations done by police officers who had prior no idea of legislation and their role in this traffic and the impact of this traffic. And then they went out and did it. Was very exciting. So why is this important and increasingly important? Our population is growing. The connection and proximity between animals and the environment increases. We live closer together. We have the climate change and land use change. Global travel is easy and frequent. And of course, our animals, so we also have a lot of pets and contact with animals, all of which makes it a lot easier for these diseases to jump around between animals and people. And with this One Health approach, we try to tackle these threats by looking at all angles and figuring out which angle gives us the best bang for our buck or ability to prevent these serious impacts and issues on human, animal, plant, and environmental health. The importance of cooperation cannot be overstated. It's in multidisciplinary and very complex science. And quite often, I have experienced the ultimate challenge being getting along with other humans that we have to cooperate with, because it's not possible for any single discipline to take this on. So it takes human medicine, veterinary medicine, and a lot more. As you can see here, it involves everyone from lab workers and scientists and ecologists and biologists, policymakers, healthcare workers, epidemiologists. They need to look at all these trends, pet owners, so the general public, farmers, and veterinarians are a bit on the top of this list here because as veterinarians, we learn about the zoonosis, which is such an life-threatening issue. And yeah, working together is absolutely key. Collaboration, communication, coordination are essential. The goal for our program was to prevent and mitigate conflict and crime, and to decrease the mortality of wildlife, at the same time, also the zoonosis risk for humans. Anthropocentric in the end again, but we're talking to funders who are humans. Preferred outcome for our patients, release, and yeah, emphasis again on that lofty program goal. A very exciting recent collaboration in Belize is now the National One Health Committee, which Belize is one of the first countries in Latin America that has created this. It's a governmental committee that we are now joining, as well as the wildlife clinic. I was invited to participate in the FETP training program for field epidemiology, Frontline One Health, which is from the CDC and was hosted by our Ministry of Health. We had a whole cohort, so this is our ambulance in the field for our field investigation. We looked for human and animal cases and vectors of leishmaniasis or leishmaniosis. And here we have a public health officer. This is a veterinary colleague, former chief veterinary officer for the country. This is a public health nurse. This is a hospital educator. This is the coordinator for the program. And here is a human doctor. And the rest of the group is somewhere else. But it was a first multidisciplinary One Health investigation in Belize. With household interviews. And we did indeed identify 2 new human cases as well as 2 animal cases in this, which surprised me a lot. It led to only the 4th report for the country for this disease. And yeah, the first truly multidisciplinary, mostly governmental, but our little NGO was there as well, collaboration under this One Health. Ultimate goal, coexistence. And one health for all. Here, one of my favorites, baby boa with a giant rat. So that's cooperation at its best. They're pest control. And that is the end of this presentation. So thank you so much for your attention. I am going to be on the chat to check for your questions. And yeah, another shout out to check out our website, look at our YouTube channel, and you can find a bit more information on this there. Thank you so much.